This program is for those that are suffering from sciatica. Now, sciatica is nothing but a junk term. The problem with sciatica is that there's many different parts of the body that sciatica can come from. It can come from a bulging disc pressing on a nerve. It can actually come from the facets of the spine. But there's also sciatica that can actually come from the SI joint itself. And then there's another space where the sciatica can come from, and that's from the Riche space. And the Riche space is on the posterior part of the sacrum. And along the sacral border, you have a place called the Champignon band. And then running this way, you have the sacrospinous ligament. And then you have the Boysen's arch, which has a very intimate connection with the gluteus medius. And running in between all of those structures, you have the piriformis. And running beneath the piriformis, you have the sciatic nerve. And again, sometimes the sciatic nerve actually pierces the piriformis. So some people have a total different anatomy structure than the next person. In this program here, what I want to show you is I want to show you 4 moves that will take care of this place back here called the Riche space. Again, it's 4 different moves that we're going to do up against the wall. And I want you to do these moves on both sides of the body. And please, below in the notes, if this helped out your sciatica, please let me know. These are the 4 specific moves that I want you to do against the wall to hopefully help you alleviate your sciatica. These are done in no specific order, and I'm not going to give them each individual names. These are specific eldoas that were taught to me by the late, great osteopath, Dr. Guy Voyer. So the first one, what you're going to do is you're going to get on the wall in the L5S1 posture, and you're going to get your legs up the wall, butts touching the wall if you can, lie your head back, and just go ahead and chill for 30 seconds, letting everything settle into the floor. Now, once the 30 seconds is up, I'm going to demonstrate this on the right side. But I want you to do both sides always, and you're going to hold the position for 1 minute. I want you to take that left leg, I want you to internally rotate it, pull the big toe down to the nose, and slide that leg out at a 45-degree angle. Now from here, you're going to bend that right leg, and you're going to bring the heel close to the left knee. Now, you have some options. You can go ahead and spread the fingers, pull the wrist back, bring both arms above your head, and push your palms away from you. And now what I'm simply going to do is I'm going to drive my left heel to the ceiling, and now I'm going to drive my right knee into the wall like that. And I'm going to hold and breathe for 1 minute. If you feel like you want to give yourself a little bit of pressure on that right side, go ahead and push that right knee down into the wall, or toward the wall. And just remember, keep your eyes down on the wall, spread those fingers, pull the wrist back, push your left arm away from you. You're driving your left heel to the ceiling. And again, you're pushing that right knee into the wall, but you can also just push the right knee into the wall with your own power and bring that right arm up overhead. Work for 1 minute. When the clock goes off, you're going to slowly relax your arms. You're going to slowly relax your legs. You're going to straighten your legs. You're going to rest in the L5S1 posture for 30 seconds, and then you're simply going to switch sides and do that same exact thing on the other side. And this is the first move that I want you to do to help alleviate your sciatica. Now, the second move I want you to do for your sciatica is you're back in that L5S1 posture. You've straightened your legs, you've rested for 30 seconds,